My name is Liem, and I'm a third year PhD student at Northwestern University. And today I'd like to share a work in progress of my dissertation research, which is focused on co-creating a custom LLM with LGBTQ plus teens focused on sexual health empowerment. I just want to note that we haven't started the study. We're currently nearing the end of our recruitment process, but I'd like to take this opportunity to share some of the strategies and practices that I've used to prepare for co-design, spark a discussion, and hopefully make some way for future collaborations within this field of participatory AI. So for some context, in the US, LGBTQ plus teens represent a rapidly growing community of the US population, with approximately 1 in 5 Gen Z identifying as LGBTQ plus, and this number is projected to only grow over the next couple of years. And as we look at the current state of sexual health education across the US, we see that 72% of sexual education programs completely omit LGBTQ plus topics. And especially if you might have heard with the recent administration, that is again at risk for potential revocal. This means that the majority of LGBTQ plus youth are navigating sexual and gender identity and sexual health without formal guidance or resources that reflect their unique experiences. And as a result of these disparities, oftentimes a lot of like queer students, teens seek queer inclusive sexual health education online, and they tend to search for health information online much more than their non-queer peers. And so tying this back to AI, AI-driven personalization in healthcare is rising among Gen Z, where 1 in 5 teens are using generative AI daily, and this number is projected to grow. And nearly 1 in 3 young people are turning to large language models for health information. For LGBTQ plus youth in particular who face barriers to inclusive health education, AI can be a source to serve as a crucial resource in the absence of reliable formal education, especially for those who might be in rather conservative areas or rural areas where they might want to answer questions but don't have the means or communities to seek. This underscores the need for inclusively designed AI, as these tools are becoming key sources of information for marginalized communities. However, we do know that AI models are trained on cisnormative and heteronormative data sets, posing potential harms to queer users. And so, as a participatory AI researcher, I'm dedicated to reimagining the development and goals of AI in ways that reflect a societal commitment to collective liberation, justice, and care. So for my dissertation, I'm hoping to explore how we can use participatory design methods to create ethical and inclusive AI tools to improve sexual health education with and for queer teens. My research mission is rooted in the belief that AI can be more than a tool of efficiency, and hopefully can be a partner in the human project of care, liberation, and justice. And so, who am I working with? Well, I'm based at the Northwestern Institute for Sexual and Gender Minority Health and Wellbeing, where we conduct a lot of research around LGBTQ plus health. And we have an amazing group of teams called the Youth Advisory Council, housed within our Teen Health Lab. I'll be referring to this council as the YAC throughout this presentation. And these are teens across the United States ranging from 13 to 18, representing a diverse group of gender and sexual identities and racial demographics as well. Recently, many of our participants have aged out. They turned 19, which is why I've been pausing and taking a step back to doing recruitment before we can get started with my specific study. So at a high level, my research has 3 key aims with our participants, and I'll keep this very brief, and the slides will be online, so you can go ahead and check the specific aims there later. But first, I'm following the principles of constitutional AI. I'll be working with our YAC to develop a moral framework for how AI should interact with LGBTQ plus teens. Through workshops and one-on-one interviews, they'll be exposed to different potential AI harms and benefits to allow them to understand exactly how might this fit into their lives, if any, which can shape a guiding framework that will serve as the foundation for co-designing a custom LLM. Next, we'll be using an open source model to fine tune it with teen approved data sets. So they'll be involved in curating these data sets with me. And they'll also be conducting usability testing, which will be using that feedback to iterate on the framework and the model. And we'll also have a separate model to conduct some adversarial testing to test for edge cases. Finally, we're really harnessing into the expertise of these teams after growing and engaging in this process. And we're going to be developing an AI literacy toolkit that is informed by them. And this will accompany the public release of the LLM, ensuring that queer teens everywhere have both access to the tool and also the resources to navigate potential AI biases. And so some expected outcomes from this, again, the digital deliverables of a custom LLM posted at the ISGEM's website, open for all teams to use, and also an AI literacy toolkit to navigate the potential biases of AI tools. Hopefully contributing to this like larger discussion of community engaged and community-centered AI, and hopefully advancing practices in equitable AI that center historically excluded voices. And so I want to spend the rest of this time talking more about the practical logistics of how this gets done. Because we are operating across the US, we actually have a Discord server for our team participants, which is an invite-only private server managed by a research team. This serves as a community space for our teams and a hub for research activities since they aren't just working on my study, but they're advising on a variety of other digital sexual health interventions. And participation is entirely online, blending asynchronous engagement on Discord with synchronous workshops and usability testing over Zoom. And so before even getting to this project, we engaged the YAC to understand what's some of their appetite for this type of work. I just pose here some examples of questions that I asked, but I bring these examples as a commitment to really lean into where our participants are at. So, for example, one of the questions I asked was, what are you most interested in using AI for? And by and large, the majority of people were interested in potentially navigating sexual health information or practicing difficult conversations like coming out to a friend, loved one, or someone that they're trying to build confidence in. And I also wanted to ask questions about what might be some things that they're excited about in this project, since the youth engage in this council because they want to make a difference. And the majority of folks were interested in helping to reduce bias and misinformation AI tools, and also being part of this larger collective of youth empowerment to build on what does it look like to build more equitable tools. And so, some just like tips for youth engagement that I've learned in the last year. I want to note that the majority of our participants, or actually all of our participants, have gone through a formidable amount of their primary education years on Zoom over the pandemic. And so, online and Zoom fatigue can be a real barrier for engagement with them. So, to keep online engagement more sustainable and interesting, we dedicate some time to create a playful online environment, like creating community generated playlists with them. These are teens, and engaging in this paid engagement is just like another thing in their repertoire. And so we create things like Spotify Wrapped to show their summaries of like how they've helped out with our studies and also detail the research contributions as well. And I know we're running low on time, but we also want to share AI literacy development resources with them, which are also included in the workshops that I facilitate in the beginning. And so just some acknowledgements of the team, and I look forward to your discussion questions. Yeah, thank you.
Thanks, Will.